Hi, and welcome to our show, Dee Talks, the Art of Specialty Lenses. I'm your host, Dee Reyes. Thank you for joining us on our adventure today. Today, we have a fantastic practitioner with us. Her name is Sindt. Christine, tell us a little bit about yourself.
Well, I have been practicing the art of contact lenses for almost 26 years now here at the University of Iowa. I am currently a clinical professor of ophthalmology here at the university. I have my own company, I print prosthetics, where I design specialty contact lenses for very sick and diseased eyes. I have 4 kids, 2 bigs and 2 littles. So my oldest is 24 and my youngest is 5. And I do a variety of other things, publishing and research, smart contact lens research. It's a lot of fun. I stay a little bit busy.
It sounds that way. And as long as I've known you, I can tell you stay really busy. So I just have a couple of questions for you, because I know you've been in the industry a long time and you really specialize in specialty lenses and the art of that. And I know it's one of your passions, and that's really what we want to focus on today, is some of the passion that you have. And I want to ask you a little bit about GP lenses, because I know now there's a huge push for scleral lenses. Where do you feel like GP lenses fit into a specialty lens practice?
Well, that's funny that you ask that, because, when I started in this industry, there weren't scleral lenses as we know them today. But I literally had a fitting set from the early 1950s, maybe a little bit earlier than that, in my practice, because my practice is so old. And I remember thinking in the mid 1990s, I can do something with these scleral lenses. So early on, I was a big scleral lens pusher, if you will, growing it and educating and learning about scleral lenses. And, it's been exciting to watch as people catch on, and more people, sort of this bulk of people, are now doing scleral lenses. And I find it really ironic, because I really am such a scleral lens person, that I find myself now saying to people, oh, whoa, back off. You can do that with a GP lens. Like, you don't have to drive the Cadillac of everything. You can do this with a much simpler thing. And the thing is, I think it's, as I become maybe older, maybe more seasoned, maybe more comfortable with the eyes and people and who I am. But GP lenses really are cost effective. They're easy. They have very little downside to them, other than you need to know what you're doing to fit them, and you have to be comfortable with yourself to get people through the adaptation period of wearing GP lenses. And so I think that's where it comes in, is being comfortable having that conversation about discomfort.
Well, and do you think the verbiage that you talk to patients, do you think that really has a difference to them and the way they're perceiving the lenses that you're putting on?
It's not just the words that I use, it's how I say it, it's my body language. It's in some ways it's my experience, but being able to say to somebody, I know you're going to be fine. You're going to be fine. We're going to walk through a little bit of a storm. We're going to walk through it together. I know what it looks like when we get on the other side, and you just have to be comfortable with me helping you get there. I think patients, it's something that people feel. They feel confidence in people. And when they feel confidence, it doesn't matter what lens you're fitting. If you feel comfortable fitting it, the patient's comfortable with it. If you have anxiety about something that's happening with the patient, they will have anxiety. They can feel it. We feel off of each other, whether it's said or unsaid.
Right. And I see that with a lot of new fitters when they're coming out, they may not have that confidence enough to exude it. But you see these new fitters that really are a little bit afraid of the lens that they're themselves. And they tend to have that with the patients as well, because if they're afraid of a GP lens, the patient's going to be afraid. So you're absolutely right.
I think one of the great things about today that wasn't there when I was a new fitter, right back in, because I was a new fitter and I didn't know what I was doing at one point. I just knew that I wanted to do it. And sometimes that's all it takes to get us over that hurdle. But one of the things that's available to people today is you can phone a friend. I'm so lucky that so many people have my cell phone number, and they'll text me and they'll be like, I'm in clinic and I've had this thing going on and I'm uncomfortable. what do I do? Where do I go from here?
Right.
And what a privilege it is to get to this point in my life where I'm that person.
And believe me, we appreciate you for that.
But I have my friends too. I mean, I have people too. I phone friends. I take pictures of stuff. I text it off to, colleagues and people who I seek advice to. And I think that's what's beautiful about our industry is I think we genuinely all like each other.
It's true.
And it just makes it easier.
So I also know that you have a passion for pediatrics. So in that realm, and I work with a lot of pediatric patients as well, are you choosing GP lenses over other modalities in most cases, or
how are you predominantly fit GP lenses? A GP lens has to fail. Like I have to prove that it is going to fail in order to not fit a GP lens for a baby, so it is a rare case that I'm not on a newborn. We're talking little babes at arms.
Yeah.
It's a rare case that I am putting anything except a gas perm lens on there. Right? There's so many reasons why it's better. It's easier to put on and off. It's less risk of infection. If it doesn't fit, it just simply pops out. Your oxygen transmission is better. It corrects the vision better. Any cylinder that's on the child's cornea, it just covers it up. So on these aphakic children, you literally only have to scope one meridian. So it's 1,000 times easier. It acts like a tonometer. So really, if the pressure goes up in the eye, the lens pops out. If it pops out frequently, they should bring the patient in. I can't even tell you how many times I've caught glaucoma on these little guys because their lens is popping out. They're inexpensive. It's easy to turn around a lens and get another one quickly. And in many cases, I'm the one buying the lens for the baby. There might be a baby born next week that we don't know about this week, and I've got to get a lens on him in 2 weeks from now. And, so the first lens sometimes is a lens that I end up buying for the baby. It's where all my charity goes.
Right.
And I would rather buy a $30 lens than a $160 lens for a child. So it's just on every level, it is a better lens.
So what do you feel is your artistic talent when it comes to contact lenses?
It's not about the plastic, it's about the patient, right? I don't think there's really any specialty contact lenses. I think there's specialty eyes. I think there's specialty patients. And it really comes down to knowing where you're going to make mistakes, where the problems are going to be, and to be able to look at a patient and say, you've got a little bump right there, and that's going to get into our way, or your graft is thin in this area, or you have this history of herpetic infection and I have to treat you appropriately, or I'm going to flare your herpetic situation back up again. It's knowing the medical treatment for these patients. And the contact lens is nothing more than a piece of plastic, whether you're fitting a GP lens or you're fitting a scleral lens, fit the thing that's going to be the best for that particular patient. But the key to fitting is knowing where your problems are going to be and not having problems. Right. I am fond of saying, if I made it look easy, you're welcome.
Well, and in some cases you have.
Yeah.
So if you could give advice to a new fitter with the experience that you've got, if you could give advice to new fitters, what's the biggest piece of advice that you would give to them?
Anybody that has passion will have the ability to be fantastic. Contact lens fitting is a lot about empathy. It's a lot about understanding the patient's lifestyle and really understanding your patient and getting to it. So, anybody who's willing to dig into their patients and hear their patients and understand them, that's the fundamental basis for fitting, for being a good new fitter. Right? Everything else after that is academic, right? But that's the part that is hard to teach somebody how to do. So if you have somebody that has that basis, then our profession has so many resources, has so many people, whether it's a colleague or it's a lab or it's a consultant, call your consultant, send them pictures, text them pictures. This is what I'm doing. and just experience. The more you do it, the more you will learn. But don't dabble. Like, either choose to understand what you're fitting or choose to do something else. But it's not about the plastic.
I agree. I absolutely agree with you. So I want to switch gears a little bit, because I know that you consider contact lenses your artistic talent, but in the industry, we have a number of people that have been in the industry for a long time that are very artistic in other ways. Myself, I cook. That's what I do.
I eat.
You create contact lenses, and beautifully, I might add. One of our consultants, actually at ABB, has done some really interesting artwork that I want to kind of look at with you and kind of get your feedback on some of it. Sherry McMahon is a pour painter. Now, I don't know if you know what pour painting is, but it's kind of where you take a lot of different colors and you pour it over a mat, and you just allow it to be and to turn into something. Conversations I've had with Sherry, it's funny how every time we look at this art, we see eyes. And we can pick them out. And that's one of the things that I see in almost every piece that I've seen Sherry do. So the first one I really want to look at is called Rise Up. And I would like you to just kind of give me a little bit of your take on this particular type of art and what you see in it.
Yeah, so I actually have done some pour painting. Oh, cool. And I have a piece over my mantle that I would like to call It's a Hot Mess. But it's the colors of my room. So, I don't have anything better, and it was kind of fun. It's fun to do. I think I'm a texture person, right? So when I look at these paintings, to me, I see things, I think three-dimensionally. So when I see this, I see these depths into the paintings. To me, it looks like things are popping out at me, and I can see the texture, sort of like I want to put my fingers in it and just move it around a little bit. I see it's organic. There's motion to the whole thing. So it doesn't look like still art to me.
Yeah, I see the movement as well. And that's kind of the way Sherry calls it, a cyclone of color. So I really like that. So our second piece is called Wisteria. And Sherry really describes it as a lazy day spent in nature with the movement and prismatic light and sparkling waters and things like that. When I look at it, I do see water in itself, but there's some other things that I see in it as well. So what do you see in that type of painting?
Well, I definitely can see the water in that painting. To me, it looks like leaves on a pond. Like if I were to scatter rose petals on the surface of a like a koi pond or something like that. That's what I feel like I see into it. Like the pink is higher up, and then it gets deeper and deeper, and the deep blue is way down, and almost like that there's froth or foam on it, and the deep blue there is the shadow cast by the froth on the surface of the ocean or the water.
Yeah. They're beautiful paintings, and I know Sherry has done a number of these. So if you guys are
beautiful over my mantle.
Yeah, it's something I want to try, but I'm just a little bit afraid to, because it would be a hot mess. All right, Christine, thank you so much for your time. If any of you guys are interested in Sherry's art, Sherry has a website or an email that you can reach out to her. It's sherrymcm@gmail.com, and that's SHERREMCM@gmail.com. If you're interested in any of her art. Christine, thank you so much for being here. I love talking to you. I could talk to you all day long, and we have. So
we've had many a fun evening.
Oh, absolutely, absolutely. All right, thank you. Thank you so much.
Bye.
And thank you everyone for attending today. We have had a great time today with Christine and really enjoyed her. I do want to put a special thanks out there to ABB for their support, and stay tuned for future episodes of DD Talks, where we sculpt together the art of specialty lenses.